4. It is ZuluTime episode number 4. The unexpected things that are making you sick. And so what are the unexpected things that are making you sick? YouTubers, how are you all doing out there? Facebook, Ubers, new word that I invented. How are you all doing there? I hope everybody is doing outstanding. And so what is this all about, right? What is it that is making us sick that is unexpected? When you begin to look into health a lot, you have to, I always try to understand, like, why are some people trying to watch what they eat? Why are some people trying to watch, like, what ingredients are in their food? And why all of these things? And so, to give you a little bit of backstory, I grew up when I was growing up, and we ate, I would say that, a lot of processed food, probably, mostly bought from the store, but we had a little tienda across the, around the corner, and I used to always go get the stuff there. So we did have a lot of legumes and a lot of food that is real food. As I grew in medical school, and in college, probably my diet wasn't, it was pretty bad actually. In medical school, it was pretty bad. It was like cheese sticks and Red Bull, just horrible. Just again and again, like that's what I would live off of that, right? And so, and I knew it wasn't healthy, but I didn't know why. You just kind of know, and it was easy. So I did it, so you just eat it, right? And so, as I started to understand that there is so much more to health, and if I really wanted to help my patients, I need to really look into this, right? I need to definitely look into it and see how everything that we get put on, and what, in terms of creams and shampoos and anything that we eat is made through a process. And if those processes have chemicals in them, then it can really affect our health in a really negative way. So my desire was just really to get a handle on this and understand what was going on. And so the first time that I started, the struggle is that I didn't know anything. In medical school, we don't get really taught environmental medicine that much. And so we don't really get it taught in environmental medicine. So, hey Michelle, what's happening? And so we don't know anything about, like, what are we being exposed to, what is in the foods, what type of pesticides are used. And so as a lot of doctors, we don't know because we didn't get trained on it. And so I think that was the first obstacle, because I couldn't really tell my patients, like, oh yeah, that brand is bad, this brand is good, this supplement is good. Like, I didn't know myself. And then internally, I was thinking more like, you're just used to eating certain things, so you don't want to really change a lot of things. You don't want to change what you eat. You don't want to. I didn't want to change anything. So that started a whole process of being, kind of hitting in the wall, and being able to, like, okay, I need to learn for my patients and for myself what's in all of this stuff. And so I think that kind of opened up an opportunity, right? An opportunity that if I could learn this, then I could really help my patients, like, protect themselves from different toxins, and protect themselves from environmental hazards, and just protect themselves, period, And so I think when I realized that I didn't know anything about this subject, that's when I really started looking into anything that would help me understand that. And I think when I started having, like, a lot of insights about it was when I enrolled, this is after medical school, after residency training, after college. So this is years, like, into practice already. And then, so I decided to do a course, me and Mary decided to do a course on integrative nutrition. Because, I was finding myself going from diet to diet, right? Like, going into the ketogenic diet and learning about that, going into the vegan diet and learning about that, and going into this diet, that diet, and the other. And it was a cool process, but it made me realize, like, wow, like, how do I help patients now? How do I really help patients now? So when I went into the Integrative Institute of Nutrition, with IIN, which is awesome. I would recommend it if you're into nutrition at all. Like, you know, I'm not getting any paid for answering, for, you know, saying it here, but it's just an awesome program that is very thorough, and it takes you through what integrative nutrition is, right? And so, which is awesome. It was great for me because that's what really taught me everything about nutrition. It taught me so many different things, and that's when I heard about environmental toxins, and I never heard about this before. But then they went into, for instance, I'll break it down, like I'll give you an example. We looked at these, I was looking at this product that we have, right? And it's called fragrance. Fragrance. Look back right now, go back to your pantry or go under the sink and pick out something, right? Most of the times in this country, you're gonna look at something and it's gonna say fragrance, right? Can you tell me right now, unless you're like a geek about environmental medicine, what is fragrance? Can you tell me that right now? I couldn't. And so when patients ask me like, hey, is this safe? Like, I have no idea, right? So I have to go learn about this, right? And then I start looking into it, and I realize and I see that actually the word fragrance is illegal in many countries because you don't know what the hell is in it. And so then I was like, wow, it's not illegal here? That's kind of not cool. And so then I have to dig deeper and deeper and say, okay, so what is the word fragrance in the back of a shampoo, in the back of a soap, in the back of whatever? And then I started looking into it, and so there were some studies that were done, and it showed that about like a big percentage of it, I can't remember the number exactly, but a big percentage of it were actually petrochemicals, right? And benzene, when they studied them, it was benzene derived products, sometimes for smell, sometimes for other things. And they put fragrance because it just sounds like it's something good, right? But then when you look at it, most of these petrochemicals have actually been linked to cancer. So then I'm like, holy crap, like this is insane, you know, because there is so many things in our house that has fragrance, that has that word fragrance. So then it just led me to like, you know, part of you, when you read this, you're like, oh my God, like I don't want to buy anything. Like you kind of just want to lock yourself and like not like protect yourself from all of this. But you know, of course you can't, because it's all around. It's so many of these environmental toxins are all around us. So, but it did make me realize that the problem is definitely bigger than what I think it is, or that what I knew it to be, because I couldn't really find. And then when I looked into the websites of these products, like you couldn't really find exactly what they put in it. So you literally don't know, right? In other countries, it's illegal to put fragrance. And so when you break it down, it's actually a lot of these chemicals that are under that fragrance category are actually petrochemicals, and they're actually being associated and increases rate of all types of cancer. All types of cancer. So I don't want to scare you or anything, but if you look in your closet or in the pantry or in the cleaning supply, you're gonna see that so many of our products have this thing on it, right? Unless you're conscious about this whole thing and environmental medicine and everything. And so just think about that and see what you want to do about it. If you don't care, that's okay too. It's just that at least that you know that there is something there, and that if you want to improve your health or decrease the chance or decrease the probability of something that you've been putting in your body that is toxic, then you definitely want to look into this. It is mind-blowing, right? And so, of course, I have this insight, and then I'm like, okay, you know, after this, I'm gonna be like clean, like completely clean. I'm gonna get all this shit out of my house. I'm gonna like stop exposing my kids and my family to this, and just like, and tell all my patients and everything. And then you realize like, oh my God, like it's in everything, right? Like fragrance is in everything, and that's just one of the ingredients that, and I just bring that because it was an example that came to my mind right now. But it really makes you think hard, right? It made me think hard about how to come to terms with this. because part of you is like, holy crap, like it's all around me, right? So how do I get it out, and how do I decrease the chances of me and putting something in my family that's going to harm them? So I think I definitely stopped buying a lot of chemicals, a lot of products, shampoos, these sort of things that contain these ingredients, right? I started realizing that the simpler it is, the better. Of course, there are chemicals in biochemistry, and chemistry and industry has evolved for a reason. It allows us to have so many different products, and is beneficial in so many ways. So you just got to have a good something that you're happy with, that you feel pretty good with, that you're authentic with it, that like, hey, I'm cool with this plan, right? And so for me, it was like, okay, I don't want to definitely buy anything that has fragrance on it, because I have no clue what's in it. Literally, I don't know what it is. So I could be putting stuff that is gonna hurt my body, decrease the energy, increase inflammation, all of that. So I definitely did that, and that was a great opportunity. And then, when I tried, and then, I think like, okay, everybody loves like this information, and I go test it with patients, and a lot of them actually don't want to hear it, right? A lot of them don't want to hear it. A lot of colleagues don't want to hear it. I don't want to hear it sometimes, right? But it's impacting my health, so I need to kind of look into it. If I want to have like high performance energy, if I want to have energy to play with my family, and decrease the chances of I'm putting something that's gonna hurt me in the end. So definitely I started kind of looking into that. And also part of the plan was to really start looking more into and how this would affect health. And so I think that's when the integrative medicine fellowship came into place, and it helped me, and it continues to help me in how to discern through all of this and really put it in a way that can actually help patients take decisions that they're happy with about their health. And one of the things that conflicts is actually when you start implementing this into the patients, some of the biggest conflicts is really making people aware of this, right? And because it's in everywhere, in foods, in cleaning supplies, in self-care supplies. So it takes a lot of effort to actually go into your house and take out all this stuff, right? But it's almost like taking micro doses of toxins away consistently out of your presence and out of your family's way. And so you would think that it was something important. Also, a lot of the chemicals have been linked to a specific disease, right? And so I came across the work of Dr. Pizzorno through the AIHM, and if you're interested into learning more about this is definitely one of the most amazing works on this. This man has worked on this year after year after year. He's out of Columbia University, and he's written many books on it, and it's just amazing, his wealth of knowledge. And listening to him is amazing, because in the studies that they show, it's actually like 10, 20, 30% that environmental toxins have a direct effect on a lot of disease states. So it's like 20 or 30% that it has an increase of diabetes. It's like 10 or 20 or 30% that it has an increase on depression, anxiety, schizophrenia. Like, you keep naming disease after disease after disease, and it's almost hard to believe, because it's almost like an elephant in the room that is, nobody wants to talk about it, but it's hard to talk about it because you just don't know. You don't know what's in this stuff. And so he really breaks it down, and with his research is actually pinpoint down exactly how much percentage environmental toxins has to a different disease. So, you could be putting stuff and cleaning stuff with that you're actually giving yourself more chances of getting type 2 diabetes, giving yourself more chances of getting depression, anxiety, schizophrenia, ADHD. And so I would definitely want to know that information, right? And so yeah, Dr. Pisorno, great resource. And I think, I was listening to an NPR radio the other day where they were talking about the epidemic of this that is in Detroit. And so, you think, for me, I think that oh, okay, a lot of times I thought about this like, oh, this is just information, whatever, like it's just nerdy people and like health nerds that just kind of go a little too crazy on that side. But then you start looking at it and it's like, oh, like this is a problem, like this is hurting my kids, like this is increasing the chance for disease. And take for instance in Detroit, they surveyed the water and 70% of the kids have higher levels of lead in public schools in Detroit than they should. So that's like mind-blowing because lead is associated with HDHD, high levels of lead associated with like mental and cognitive decline and so many things, and you can keep going and going and going and going and going of how much this is impacting the health of those kids. And so they're not concentrating, they're taking poor decisions, all these things. And there's like poison, right? And now that you know that, you find yourself, it's like I always say, you find a solution. Anytime you find a solution, you just bought yourself a new problem, right? So, once you learn this information for the city of Detroit, they were like, wow, this is a huge elephant in the room that we need to like address now because it's hurting our kids. So how do you go about replacing all the pipes, all the system, the water systems in every school, in all the schools of Detroit? It's an elephant. So that's why I think environmental medicine is so important. I think first because it makes us look back and realize like what we have now, the infrastructure that we have right now has to be assessed to make sure that it's safe for us and make sure that it's not causing unnecessary suffering for our families and our communities. And the second thing is that it's going to allow us to look her in the mirror and say, okay, what type of building do I want to build? What type of product do I want to create? What type of cleaning supply do I want to create? What type of stuff do I want to use, right? So that we can start forging the future in which we are actually not hurt by the things that we're using, right? And so I think that that's really important. And I think to this day now, after hearing all of this, definitely I've incorporated that into our projects, incorporated that into my own life, incorporated in a way that is continuously learning. I'm continuously learning about it. And I'm still trying to find ways of how we're going to be able to measure this and see the impacts, kind of like Dr. Pisorno's work. That if we work in a community, improving the water or changing different things about the things they consume and the food source, definitely that would help, forge a future in which we are safer. One of the latest things that I read that they just kind of clicked in my mind as I'm talking about food supply is that, here being in Hawaii in the farm is made me really think about like where the food comes from. Like when we're processing our coffee and, what am I putting on the fertilizer? What am I putting on the stuff that kills the bugs around the coffee so they don't eat the coffee? What am I putting so that it doesn't go bad before we take it to be processed? What am I putting after that? And so what's the package made of? Like all these little different steps. People don't like maliciously think I'm gonna put something in there that hurts people. It's not like that. It's like you realize that like, wow, like it's hard to package, it's hard to make these products, it's hard to actually make it safe, but it's worth it, right? And so I think that's one of the biggest transformations, and also that I am a lot more mindful as to realizing that this is affecting our patients, it is affecting populations. If you see 10 patients with depression, 2 of them are being affected by this, right? 10 patients with anxiety, schizophrenia, they're being affected by this. So we definitely, as healthcare practitioners or as anybody who's in the business of health, definitely needs to take a look at this, right? And so one of the things that made me thought about that, about the farm and the fruits and everything, is that there's this organization called EGW, I think it's EGW, and they came up with this list called the Dirty Dozen and the Clean 15. and that breaks down fruits and vegetables that are clean. They say, for instance, like they test 100 apples from different sources, right? And they come up with like, okay, these apples, actually 80% of them have this toxin, right? And so when you look at those two lists, it's great because you're able to like, wow, like foods that I thought they were safe, yes, like 80% of them have like this toxin. So it's insane, right? And so where are you getting this food from, right? And so it's made you think a lot about that. And now I'm really looking forward to sharing this information with my patients so that they can feel empowered, because they can vote with their dollars and they can go buy stuff that is healthy for them and that's not gonna hurt their families. And they can buy fruits that come from a place that is safe, and the same with the vegetables and everything. And I can also get involved with the hospitals and the cities as to transforming this into more healthy and ingredients and infrastructure that actually sustain and improves our health, right? And so that was the time. It was Zulu time. This is the end of podcast number 4. If you have any questions, concerns, comments, suggestions for episodes, let us know. This is a conversation for everybody so that we all get involved and that we all make an impact in ourselves, in our families, in our communities, and thrive on. Have an outstanding Sunday. Take it easy.